Do you have pain travelling down your arm? Maybe it's coming from the neck, or you're not sure if it's coming from the shoulder or a trapped nerve in the arm. Well, we're going to go over some of the different causes in this video and the things you can do about it. I'm Anthony Gosh, I'm the lead neurosurgeon at the Spine MDT. Make sure you subscribe to the channel where we post weekly videos on problems with the spine and things you can do to help. And don't forget to visit our website where we have a blog page with useful information as well. None of my videos are a substitute for being assessed by a qualified healthcare professional. These are just a helpful guide. So if you've got pain radiating down your arm, there's a few different causes of that we're going to try and uncover today. Broadly speaking, it can be from a trapped nerve in the neck, it can be from a problem in the shoulder itself, or a trapped nerve within the armpit, what's called the brachial plexus in this region of the shoulder. And nerves can also get trapped, commonly behind the elbow and in the wrist, and give you various symptoms related to the arm pain. There's a common saying between ourselves and neurosurgeons and a lot of shoulder orthopedic surgeons that there's only a hand's breadth between the neck and the shoulder, and often the symptoms can mimic and overlap each other. If you've got pain sort of starting in your neck and shooting down the arm, radiating down the arm, maybe it's associated with some numbness in your fingertips or some tingling going down the arm, and quite often that's a trapped nerve in the neck, what we call cervical radiculopathy. So here's a cross section here of the cervical spine in the neck where you have a disc bulge here pinching the nerve, and that sends the pain radiating down the arm with some tingling. Sometimes, depending on which nerve is trapped, the pain can just go up to as far as the shoulder from the neck, and you can get some numbness just here at the top of the shoulder. Another nerve may send pain just to the back of the shoulder blade from the neck, usually just overlying the shoulder blade or just underneath it here, rather than anywhere near the midline. So there's ways of assessing that. Generally speaking, if it's coming from the shoulder, usually, not always, but usually it's the movement of the shoulder that aggravates it rather than the movement of the neck or movement of the arm that can aggravate it. If the problem is a trapped nerve in the neck itself, then often there are various movements of the neck, particularly leaning towards the side of the pain or turning your head that way, narrows down this channel where the nerve runs through, and that can send the pain going down the arm. If the pain is mostly in the forearm or wrist region, quite often it's a trapped nerve in that region of the arm. So if you've got no pain above the elbow level, and it's pain radiating down the forearm, it can sometimes be a trapped nerve here at the elbow called the ulnar nerve, which is the funny bone. When you knock your elbow on something, you get that funny shock that goes down the arm. Usually the pain travels down this side of the forearm to the side of the forearm where your little finger lies, and you can get tingling and numbness of the little finger and ring finger. Things like bending the elbow tend to make it worse, so patients tend to notice it, can wake them up at night time, or sometimes if you're lying there with your elbow, if you're reading a book in bed at night with the elbows bent, it tends to aggravate it more. So that's called ulnar nerve entrapment. Another common problem we see is carpal tunnel syndrome, which is thickening of a band of tissue here in the wrist, and it traps the median nerve. That often sends pain and numbness of the thumb, index and ring finger, sometimes half of the ring finger, and it can also send pain up the forearm, but you rarely get pain going above the elbow with that. So as I said earlier, if a problem is arising from the shoulder itself, it rarely radiates far down the arm. It usually goes sort of halfway down the upper arm at the most. Movement of the shoulder joint, so what we call abduction, moving the arm away from the shoulder or rotating it, trying to put your hand behind your back or touch your head, these sorts of movements can aggravate it. And it could be various problems with the shoulder, such as arthritis of the actual joint itself, or problems with the tendons where the muscles attached to the bones. The different tendons can get a bit worn down, sometimes inflamed or put under strain. And then there's a group of muscles called the rotator cuff as well, which can also cause these sorts of problems. Often I see patients that have pain just here between the shoulder blade and the spine. Often are concerned it might be nerve entrapment. Usually, actually, that's a problem with one of the rhomboid muscles, which makes up part of the rotator cuff in this area that's under strain. So what do we do about it? Well, an experienced musculoskeletal physiotherapist or your doctor, your general practitioner, should be able to get a rough idea of which is the cause from your history and your clinical examination, and then order the right tests if they're needed. Problems with the neck causing pain radiating down the arm, these usually settle down. There's a flare up of the nerve at the time of the entrapment, and then usually in most patients within a few weeks it all settles down. Where you need urgent investigation, so an MRI scan of the neck, is when you start to develop weakness in the arm itself, because what we're trying to do with the treatment is aiming at preserving your neurological function, the power in the arm. So that's where you need an urgent scan, or indeed if you start developing pain going down both arms or even weakness in your legs as well, that's an indication for an urgent MRI scan of the neck, and that's something we at the Spine MDT can arrange for our one-stop clinic, but also your general practitioner. If the problem's coming from the shoulder, again, your doctor and your musculoskeletal physiotherapist can work that out. Most of the time that can be treated with physiotherapy, but your physiotherapist will know when to refer you onwards to a shoulder orthopedic surgeon. Sometimes they like a simple plain x-ray. Depending on the examination findings, they might want to do a more in-depth study, such as an MRI scan of the shoulder, possibly even include the scapula, the shoulder blade, in that. If the symptoms are more in keeping with a trapped nerve, either in the wrist or the arm, then we do what are called nerve conduction studies. These are where especially electrodes are put on the surface. You're stimulated with an electric current, and then that current is measured so that we can work out the speed of it travelling down the nerve, and it can also, and therefore give us an accurate idea of which nerve is trapped and whereabouts it's trapped. These problems don't always need invasive treatment like an operation. If you do have a trapped nerve in the neck, and it usually will settle down, provided you don't have any weakness in the arm, and the MRI doesn't show that this structure here, the spinal cord, is compressed. There are various manipulations that a good osteopath can do, or some chiropractors, but I would only advise that if you've had an MRI showing that the spinal cord itself is free, and that's where our multidisciplinary practice, where we work together to try and guide each other, is beneficial for that. I tend to reserve surgery for when a good period of time has elapsed, the pain hasn't resolved, and you've tried these conservative measures, they failed. Then there are very minimally invasive procedures we can do to just try and untrap this bit here using microscopes through quite small incisions, and there are also some injections that can help with the pain depending on what is seen on the scan and what your findings are. That's why a clinical assessment is very important. In my experience of working with some of my orthopedic colleagues, specifically the ones that work on shoulders, is that most of the time they can treat these shoulder problems, if it is from the shoulder, with relatively conservative measures, i.e. physiotherapy and various injections. And again, a lot of the orthopedic surgeons today can do a lot of the surgery through minimally invasive techniques, and this is something that you need to discuss with a really good orthopedic shoulder surgeon. And finally, if it's a trapped nerve if it's carpal tunnel syndrome, a trapped nerve here in the wrist, or ulnar nerve entrapment here at the elbow, there are measures you can take to help initially, like just positional changes that you can get into, various habits you can get into to help prevent the symptoms coming on. There are splints you can wear around the wrist to try and hold the wrist in a position, especially when you're sleeping at night, because that's when the symptoms come on, to try and keep that carpal tunnel a little bit more open and then less symptomatic. Sometimes it needs invasive treatment. That can be an injection sometimes, or a very small operation, a very minor operation, often done under local anaesthetic or sedation just to release the nerve at the wrist or even here at the elbow. I hope you found this video helpful. Our goal at the Spine MDT is to work together as a team to find the least invasive solution that gives you the longest lasting result. And we're able to do that by being a team, a whole network of spine surgeons, chiropractors, physiotherapists, osteopaths, and even pain specialists as well. Please visit our website. Feel free to contact us by phone or by email to answer any of your questions. Thank you.